Okay, so we're going to be doing our intramuscular pass off today. I'm just going to sign on right here and compare the order to the MAR. The order right here is got the Ketorolac, that's the one we need, and then the MAR has the Ketorolac. Perfect. We're just going to click on here, and then put on some gloves. And for this medication, you wouldn't want to give to somebody who is over 20 weeks pregnant. You wouldn't want to give it to somebody who is taking other NSAIDs. You wouldn't want to. The action of this drug is to reduce inflammation and help with severe to moderate to severe pain. And then the purpose we're giving it to this patient right here is because they are in severe pain and they're having quite a bit of inflammation. The safe dose range is 15 milligrams to 60 milligrams per day. And then, yeah, I forgot to perform hand hygiene before I put my gloves on, but it's okay. So we're gonna make sure we have the correct med. We got the Ketorolac, perfect. And then I'm just gonna prepare it in the patient's med room or the patient's room. I also want to check to make sure that they don't have any allergies, no drug allergies, no food allergies on the chart. Mr. Smith, do you have any allergies that you know of? No? Okay, perfect. So we've got all our supplies right here. We've checked to make sure that that's the same thing. Perfect. Okay. So I'm just going to clean this off for about 10 seconds. Okay. We're gonna let that one air dry. Get my needle ready, my syringe. And while we're doing this, we're only gonna wanna prepare medications for one patient at a time. We don't wanna be doing 2 different ones and get everything mixed up. I'm just gonna pull this off and set it right here. And I would do the calculations first. This one says it's got 30 milligrams per milliliter and we want 15 milligrams. And so we're only gonna be getting a half of a milliliter. And the expiration date, it's not expired, so we're good there. Get rid of the air bubbles in here. Perfect. Okay, and then I'm gonna scoop this back up using the scoop method so I don't poke myself. Okay, and then if we were in the med room, we would transfer this over to the patient's room. We wanna make sure that the door's closed or the curtain's closed. Hi, Mr. Smith, can you tell me your name and date of birth? Perfect. I'm just going to scan your barcode right here. Oh, forgot to click that. Okay. Perfect. And we're going to scan the drug. Maybe. There we go. And then for this, we've got the 6 rights. We've got the safe dose, the safe route, or I guess the right dose, the right route, the right time, the right patient, and the right documentation. We're going to get some clean gloves now. I'm just going to explain to Mr. Smith what we are doing. So we're going to be giving you this Ketorolac intramuscular injection. This is to reduce the inflammation that you've been experiencing and hopefully decrease your pain levels. And then the action of this is going to reduce the inflammation that you have. Shoot, why can't I remember? Okay. just gonna make sure I don't let this go out of my sight, so I'm just gonna set it right here. Are you in a comfortable position right there? Okay, I'm just gonna expose your arm right here. We're gonna do it on this arm, on his left arm, because last time it was done on the right arm. We're just gonna clean this off for a couple seconds. We're gonna let that one air dry. And I'm gonna pull this cap off. And then we're gonna use the Z-track method where we push the skin to the side. And then we're just gonna dart this one in here and hold on to it. And then slowly inject the 10 seconds per milliliter. This is only half, so we're just gonna do 5 seconds. And then we're gonna pull it out the same 90-degree angle and then release the skin. And we're gonna engage the safety guards so I don't stab myself. And grab one of these and apply pressure right here for this patient. But we don't wanna massage the area. That will destroy some of the effects of this medication. Okay, are you feeling okay? All right. I'm gonna put them back in a comfortable position and make sure they're okay. We're gonna dispose of this in the sharps container. And then I'm gonna take these gloves off. And then perform hand hygiene. And then we're gonna go right here and make sure we've got everything documented. We've done our 3 checks. We checked their birthday. I'm just gonna document the patient teaching. I forgot to tell the patient any side effects that they would have, so they might have abdominal pain. They could have bleeding in their GI tract or anything like that. They might experience some nausea, anything like that. And then, yeah, and if they have any of that, we'd tell them to just let us know. Okay, so we've got that administered. And then good there, and then we would just make sure that they're in a comfortable position and then document that and then come back in about 10 to 15 minutes and assess them. And then we would want to assess the site where we gave the medication in about 2 to 4 hours. That's all.